I rode home from Dr. Shiffman's Park Avenue office after my breast augmentation in 1991 in a broken-down old cab with my boyfriend on one side of me and my best friend on the other in the back seat. Still loopy from the anesthesia, I remember begging the driver to try to miss all the potholes and bumps. Shiffman's nurse warned me that I probably wouldn't sleep that night. After all, I just had about 500 cc's of silicone put into my chest. During our consultation, Shiffman insisted on 500 cc's, but I really felt much more comfortable with 420 cc's, so it's my body, and we agreed to do 420. But when I woke up, I found that I had 500, which was a lot like the Shiffman. Shiffman was a crook, and we all knew it. Ignoring his patients' wishes was a common thing, and that earned him the nickname of Shifty Shiffman. Shiffman was one of 3 doctors that worked on trans women at the time, and out of the 3, Shiffman was the best. The other one, who was well known, was called Dr. Wesser the Messer. To her credit, the nurse wasn't wrong about not sleeping, even though I was able to manage to look out for a few minutes. Whatever rest I was able to get was interrupted by the feeling of wet sheets. I panicked when I found that the wet came from blood and that there was blood all over my sheets, so I called the emergency phone number he gave me. Shiffman, who wasn't a nice man, whose personality could best be described as gruff, was particularly angry when I called. "When's the last time you emptied your drains?" he asked. "Drains?" I said. "What drains?" He said, "Didn't the nurse tell you that you have drains that have to be emptied?" I said, "No, she didn't tell me." "Empty your drains," he said, "and you won't have blood all over your bed." 2 days later, when I went back to see him to have the drains taken out and the bandages removed, I realized that I was black and blue from my collarbone to my waist, and the girls were much bigger than I expected. It was about a week later, when the bruising started to fade and I was getting back to life as normal, I noticed a little tiny red spot on one of them. Better keep an eye on that, I thought. By the next day, it was bigger, it was red hot, and it hurt, so I knew it was infected, and I called the doctor. Next day in Shiffman's office, he took a look at them, checked them, and then very gruffly, he kind of barked out, "These have to come out. You'll have to wait 6 months before we can do them again," he said. 6 months? Really? Isn't there anything you can do? I pleaded. He gave me an antibiotic, warning that if the antibiotic didn't work, they'd have to come out. And the antibiotics failed to work. He told me to book an appointment to have them removed. And I said, "Please, please, isn't there something you can do?" I begged. I pleaded. I negotiated. And finally, he said, "Okay, you can go see a friend of mine, another doctor, for his opinion." The doctor suggested that Shiffman take out the infected implant, clean it, and put it back. And he said that that would probably fix it. Shiffman agreed to try. When I arrived to have the implant removed, cleaned, and replaced, Dr. Shiffman informed me that he would be doing it under local anesthesia, meaning I'd be awake for the surgery. "Don't worry, you're not going to feel anything," he grunted as I got on the table. It's on the table. He took the surgical tray, the tray he kept all of his surgical equipment on, and pushed it so it was right above my face, and making funny faces to distract me from what was going on. I remember I was able to tell when the implant came out because it made a sound kind of louder than when a cork comes out of a bottle. Even with the tray over my face, through the periphery of my vision, I could see that he took the implant and put it in something that looked like a microwave oven. After a little while, it beeped, and he took it out and put it back inside of my chest, forcing it back in through the tiny incision he made at the bottom of my nipple. When I got off the table and as I was getting dressed, he said to me, "Pray that it works." I don't know if it was the cleaning, the antibiotics, or the prayers, but it worked. The infection was gone. Those big old Shiffman boobies, they lasted me for years and served me very, very well. Years later, Shiffman lost his medical license. One of the most significant differences between my generation and this generation is that you guys have the support of the medical community. We didn't. Better late than never.